Namaskar. Once again, welcome you all in Curega Samvaad Dil Se Dil Tak. Today it's our great honor and privilege to introduce and welcome Dr. C.H. Rao, who is Senior Diabetologist and Director of Wise Diabetes Care and Research Center, Fatima Nagar, Pune. Dr. C.H. Rao having a great expertise in treatment of diabetes as well as in gestational diabetes management. And today we would like to request Dr. Rao to discuss on prevention of diabetes as well as prevention of gestational diabetes management. So once again, welcome you in Curega Samvaad Dil Se Dil Tak, and now over to you, Dr. Rao.
Hello. Thank you, Curega Pharma and Mr. Chiranjeevi for giving opportunity to share a very important aspect of pregnancy and diabetes. We are the diabetes capital of the world, we all know, but we also have a lot of mothers who, after conceiving for pregnancy, are developing diabetes. So the incidence is very high. Roughly 10 to 14% of pregnant mothers in India are getting gestational or pregnancy related diabetes. Management is very important both for mother and the growing child, because it has long-term implications for both the mother and child. Problem is, many times it is not diagnosed at the right time. The reason is it is very silent. Blood glucose is very silent. So we have to do a special test to diagnose, that is known as oral glucose challenge test. What we do in Indian setting is we give 75 grams glucose to the mother who has conceived at first visit. Whenever she comes, first visit we give that glucose, and after 2 hours we check the sugar test. Now, if it crosses above 140, if it goes above 140 after 2 hours of glucose challenge test, we call it gestational diabetes. Now, what happens in pregnancy is, in pregnancy, because of placenta, a lot of hormonal changes happen in the mother, and placenta works against the pancreas. All mothers in pregnancy have to increase insulin production by almost 80%. Some mothers that doesn't happen. So when we challenge the pancreas, and if the glucose goes above 140, that we label as gestational diabetes. Now after delivery, this becomes normal in most of the mothers, but in the long run, after delivery, after 5 years, 50% mothers may get type 2 diabetes. So after delivery, the mother and their family should not forget about diabetes. The mother should try her best to prevent diabetes in herself after say 5 years, 10 years down the line. So the best way to prevent diabetes in the mother is to maintain ideal body weight. I always say to keep this fat as less as possible. This is the most important cause for diabetes in Indians, is central obesity. So after delivery, the mother should follow good diet and good exercise plan lifelong, and keep ideal body weight so that she prevents her risk of diabetes. We see many mothers after delivery do not bother too much about diabetes, but it comes back and then that it will be long-term treatment again. And the other major cause for getting diabetes in the young generation, if we don't talk about pregnancy and diabetes, even young kids are getting obese in India, and these are the kids who develop future diabetes. And the best way to prevent diabetes in all Indians is to prevent obesity. So prevent obesity to prevent diabetes, to prevent blood pressure, cholesterol and heart issues. So this is the most important message that I want to give for all. Now for pregnancy and the child, what is important? I discussed pregnancy and mother. Now pregnancy and baby, what is important? If mother sugar goes above 140 in pregnancy, it goes in the baby's circulation and adds fat. Normal birth weight is around 3 kgs. Anything more than 4 kgs, these babies have 2 times more fat percentage. We call this obesity at birth. And these babies, when they are adults, say after 5 years, after 20 years, 25 years, they have higher chance of getting diabetes. And when we treat diabetes in pregnancy, we are trying to prevent diabetes in the next generation after 30-40 years. So that's the real reason of treating pregnancy and diabetes. But sometimes especially if the glucose is high in the first trimester, first 12 weeks of pregnancy, there is a slightly higher chance of abortions, congenital defects. But with modern management, with the amount of the care that is given nowadays, where we check the glucose for mothers on a daily basis, where we have good medical treatment, this complications are very rare nowadays, because all the hospitals, all the doctors know how to manage these cases. But it's very important to control sugar in pregnancy for both the mother and the baby. Thank you. I think that was my important message. So good diet and exercise forms the major part of treatment. There are, if you see, there are hardly any signs and symptoms. It's very silent. So unless you check, we don't usually know. But some mothers will have more thirst, more urination, slight weight loss. But this is where the most common symptom of diabetes and pregnancy diabetes is no symptom. The challenge is to diagnose it at the right time by doing proper test.